All right. Hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. A little bit different today, but I am your producer, Jeremy Carr, here with your host, Heather Pierce, to tell us what's different today. What's on our agenda for today, Heather?
Well, this is a Your Vote, Your Health episode.
There you go.
That's what's different.
Number 2 of the series.
It is. Yeah, finally.
Took us a little while to get from 1 to 2, but now we're going to have a few coming out.
Yeah, we do. We have quite a few coming. Yeah, so we've got Jackie O'Donnell Anderson, who is running for the Arizona State Legislature in Legislative District 19. So that's like Southern Arizona, like Pima County, Green Valley area.
Greeley. Safford.
Yeah. Some
Sierra Vista, I believe she said. It's a big area.
A lot of counties, because as we know here in Arizona, counties are really big and they cover a lot of land. So anyway, if you're in LD19, you're going to want to especially listen to this. If you know somebody who lives in the LD19, send this episode to them. And Jackie's going to tell us all about what she thinks about healthcare and access and Medicaid and the vouchers and public ed and things of that nature. So that's what I got.
Yeah, get to know your candidates with the Healthcare Uprising here, Your Vote, Your Health. So without further ado, here's our conversation with Jackie Anderson from LD19 in Arizona.
Hi, and welcome to the Healthcare Uprising podcast. Today is a special series for our Your Vote, Your Health series, and we have Jackie Anderson, who is running for Arizona State Legislature in Legislative District 19. Jackie, welcome to the show.
Well, thank you very much for having me. I'm looking forward. This is exciting.
Yep, you're our second guest as part of the Your Vote, Your Health series. So excited to have this conversation. So Jackie, tell us why you're running. Give us a little bit of your background and kind of what led you to coming out of retirement, as a matter of fact. And this is a lot of work. So tell us your story.
Well, thank you very much. I came out of retirement because when the big bad bill was signed last year, and they were talking about the cuts in Medicaid, which in the state of Arizona is access. So it's an acronym. I'm not going to spell the whole thing. I think everybody knows what access is. Well, access is technically the federal Medicaid program. And working as a nurse, I worked, my career is 47 years total, but I did 19 years here. And in 2012, I was laid off. And I worked at one hospital. Majority of my time was in the emergency department. And even though I don't know all the nuances of insurances, the issue is on my side is how patients are going to get care and to find beds, find providers who will accept them. But the issue is that you always have to call access, and I'm not sure how the process is still working, but you have to get pre-authorization from a physician or another, mostly it's physician to physician approval. And sometimes you have a leeway to admit people at night. You get a 23-hour window to at least admit them and continue their medical and nursing care. With that being said, there's more to it because apparently in January of 27, they're going to start rolling people off of the rolls of Medicaid based on a variety of criterias, which is kind of, and it's very subjective. So in other words, I feel like, you just don't want, if you have somebody that has limited mobility or has limited issues on how to have a job and yet still needs medication and medical care, that we are denying this person and has to go to become either in debt or just do without. And I know I'm kind of getting too far into that, but to me it was just, and the other issue is that it's not so much besides losing patients, then the clinics start to cut back. And then critical access hospitals, which I'm glad you asked about that. is a federal. It was a federal definite. It's just, it's CA. Access is. Critical access is just CHD, and it was put together by the feds through CMS to help financially vulnerable community hospitals, and these are the small community hospitals that are all over the United States. We have about 13 of them, plus the tribal have also a section of that, and it's 25 beds
like Indian
or less.
Health Services.
Indian Health Services is a different set, but there's also some tribals have their own hospital that's not part of the Indian Health Service. So there is some issues there, and there's a big map out that the U of A. It's awesome if you ever can get a hold of that map. It really gives you a lot of detail about all of besides the critical X, and the variety of because there's a hospital in Sells, Arizona, and I had a couple of docs that used to float out there and work a couple of shifts, a month. So you have to have 24/7 ER, and you have to have less than 25 beds. So here you are sitting in the ER. Hopefully our hospitalists can admit if we have a bed. If we don't have a bed, or if we don't, and we didn't have an ICU, our ICU eventually closed because you have, so if you have a ventilator patient, they have to go somewhere else. So then you have to sit and wait for hospitals in the larger communities to see if they would accept. And it is based on if they have a bed. And can they take another access patient? Because the reimbursement is low. It's very low. And and you have to spread. So every hospital has to figure out how to spread their payer mix to stay viable and stay open. So there's a lot to this. I mean, it's not going to just affect, they think they're going to just knock out, 20, 40, 50 million people and, we're going to be fine. We're not. It's a domino effect. It's not only going to hit the person who needs the care, the hospital that cares for them, the providers that care for them, then it goes down to pharmacy. Maybe the pharmacy or the local pharmacy in a community all of a sudden has 10 patients that can't come in and buy their insulin anymore because they don't have any money or they don't have any insurance. So it keeps tipping the tiles down, and eventually it'll, we had a clinic. It was a cardiac clinic, closed one of their rural communities. So now you have to 150 miles to go to Tucson to see your cardiologist. Now, yes, you can change your cardiologist, and that might work eventually, but there are some specialties that is really hard, and not every hospital is going to be able to bring in a cardiologist. You have to have at least 2 to cover 24/7. 300, you got to have coverage all the time. You can't work 7, continuously and be up every day. And so there's a lot.
So the domino effect
it's a domino effect.
This. Yeah.
And yes, I know it's a federal issue. And it started
from the bill. Yep.
Yeah, and if you pulled it, you have to look at all the little subsets that are inside each one of those items on the bill. And I'm still digging
so many things.
That.
Yeah.
Yeah. So with that going forward, I thought, why not? I have the time.
They make it.
I have the time and I have the energy, and I'm going to be ready. I am ready for the election.
That was your inspiration.
Yes, because I don't want to.
We have a bit of a delay. I apologize.
Okay.
Yeah, every time I'm talking, I think it's coming to you a little bit late. So,
okay,
I don't mean to be talking over you. Sorry about that.
No, it's okay. No, that's okay. I get started and then I forget to stop and take a breath. So that's essentially where I'm at. But there's more to it. I mean, I'm interested in issues about water and education, public education. There's numerous things. Going back to, as one of our current legislative senators said in one of the meetings that I had attended, we need numbers. We need to become the majority. We're not going to fix anything in this state until we become the majority, because currently no one, the current legislator majority does not even acknowledge the minority Democrats. They don't even allow some of their bills to even be read. or even to be logged in with a number. I mean, this is, they just, and I know they've been doing this for probably 25 to 40 years, and they're just used to doing that. And I thought about, yes, we need numbers. And I felt like I'm going to help. I can do this. And I think I can just be another voice for the people of LD19. You have a choice now. You're not going to have one party dominating your life. You need to have another party to help get things done. So that's kind of where I'm at.
Has LD19 been just Republican for, I think you said something like 20 years?
Maybe
longer.
I really don't know. I know it's been a long time. I know it changed in
a long time.
2020 the 2020 census, and I didn't keep up to date with that. I know that's when and then we changed the numbers because we had an increase in population. Mm-hmm. We're at 7.2 million, and I just looked at, because I remember we were CD2, and then we ended up being CD6. And I have kind of lost and I do remember, I think we were LD14 at some point back. So maybe it's been 10 years, maybe a little bit more. It just depends. I'm not sure between the Senate and the House. I'd have to also look at what the history is of the current legislatures are. But I think there's opportunities.
Yeah, probably good information for us to know. We should look that up. Maybe we should put some links here.
There's more people down there than I thought. Actually.
Yeah, I'm actually surprised.
7 million people in that part of the state. I'm surprised.
So it's the largest landmass. Yeah, and it's parts of 3 states, 3 counties, and Graham and Greeley are totally in 19. There's a piece of southeast Pima County, which includes Green Valley going all the way east, south of I-10, and a small little section in Vail on the north side of I-10, all of Cochise except for Bisbee, and a few areas that links to Santa Cruz. So yeah,
wow, that's a big area.
I didn't realize it was that big.
Yeah,
and it's the same number of precincts that I think every every district has. Ours is just spread around.
Spread out.
Right.
Yeah.
A lot of
in land mass, but not in
a lot of the little communities everywhere. Yeah.
Definitely. I mean, there's the major is, it's all Pima County, south of the I-10, east of Wilmot, all of Green Valley. So there's no real city. I mean, because it's all county. Cochise has got Sierra Vista, has several, towns. And then Safford and Clifton. So I mean, it's there's no other, and there's small towns in between all that, between each of the communities.
Right. Just everybody's all spread out.
Mm-hmm. So it's rural. It's
with
rural.
You being having worked. Yeah, I was just going to say, so you've worked in rural hospitals for a really long time, 19 years here in Arizona. So obviously you're bringing that expertise, that experience, and that perspective to, running for this position for LD19. And the whole thing about, I'm glad you brought up the access, right? The cuts to access. I am seeing people already being affected by that. Like people that I know personally in my life, and the whole the work requirements, which that can really push a lot of people off those Medicaid rolls that shouldn't be, because of their circumstances. And I know there's going to be exceptions and whatnot, but what kind of power do you have? Let's just say hypothetically, you win this position, you are representing LD19. What kind of influence will you have, at least on the state of Arizona, in terms of Medicaid and access and things like that? What can you do through policy and legislation in this role to help shape that going forward?
Oh, excellent question. And I do have a lot of catching up to do. And I know who to talk to on research between the U of A, public health, and also ASU. And I'm sure Northern Arizona University has probably something there to offer. So it's got to be a state it's a district issue, but it's also a statewide issue. There are current legislature policies and plans sitting in somebody's desk waiting to come forward. And that's what is probably, by becoming a majority, we can pull that out. And I'm hoping I could be on that committee and start looking at how we can bring back healthcare for all in a very concise and economically sound, program. And it's going to take some time. But I think we could do some, in the ER, you always triage, who is the sickest and who can wait. And I think overall, between all of the hospitals that are affected and the clinics, they need to be at the table, and also representative of people all throughout the state. I would have an open door policy, but I would also be able to seek out information, call people, put out something. What do you think about this idea? So I can get some feedback from my voters in my district. And I think we would all do that. And there's all kinds of subject matter experts out there. I read, I'm on the U of A's link. I try to, and I have their format that the governor has sent out about, the new program of rural health transformation program. It's got, I think it's got some good, but with the current administration, I have doubts. Will they really give us $50 million, or are they going to nudge us a little bit? But it's a start. It may not be, but I think if we're in the majority, we can have better, and with a Democratic governor, we would have better offers. I mean, I think we can come back with something, and that we're working for the people and not for a few people. There's a difference between I don't have any lobbyists, and I wouldn't have any lobbyists. So, and I know that a lot of healthcare systems are very heavy on their lobbying, and that's fine. That's their choice. Yep. But we can't go back to county hospital systems and to areas where who's going to take indigent care. Back in the 60s, I mean, if you either had to go to a Catholic hospital or some nonprofit hospital or to the county hospital. We're not going back to that. So we have to look at other, and there's so much in our technology, our medical sciences, and will help us with a lot of things that can be, and we're doing 90% probably by outpatient, but we still need to cover everybody. And it's a teamwork. It's all teamwork.
So the access right now is federally funded, right? So are you talking about replacing that with a state funded program so we don't have to rely on the federal money anymore?
I don't know. That's a good question. And that would be something that I would have to ask the Democratic caucus on where they're going with that. According to this current bill that the governor vetoed, they wanted to give a tax cut to the wealthiest people in Arizona. That money could fed back could be back into access or into schools. They don't need another tax. They got a federal tax cut. They don't need a state tax cut.
Right.
So you're right. Is there money? I have to learn, and I have to follow what the Democratic caucus is going to bring forth. California's got a different plan too. I mean, New Mexico's, everybody has a little bit variation on this federal plan. I don't think we should say no. If they're going to give us money, let's use it, because it's sure. Part of the commitment to the American people.
Sure.
Yeah.
It is our tax money after all in the end, either way. So.
And you're talking about the Rural Transformation Fund, right? When you're saying that, yeah, that's come up a couple times on the show already. Yeah. I'm actually pretty familiar with it because I work in the healthcare startup space, and the company I most recently worked for was a recipient of funding through that bill or that transformation fund because they were focused in rural America and mostly supporting seniors. And so I became pretty familiar with it. And I kept saying, well, if there's one good thing that came out of the big, beautiful bill, it was maybe that. But to your
I like
point,
the way she called it better. The big bad bill.
The big bad bill, the BBB. But to your point though, are we going to actually get that money? Because look at how many grants and all these programs that have now had their funding ripped away from them that were already like essentially legally given, right, by like Congress, and now they pulled all that money back. Is it going to be the same thing when the administration doesn't agree with what the goals are of maybe that organization because they're not bowing down? I mean, I wondered the same thing. Will they actually receive that money? And what do you have to do to get it? Right? Do you
Well,
have to
when you
violate
read,
your own personal values?
well, that's a good question. And they're asking for, and they did get it approved up to, and I have it in front of me, but you're right. I need somebody else to help walk me through it. But my thought was, one thing I wanted to say was, they want a certain amount of work-related requirements. And that's okay, but where is the break for seniors, children who are in a living situation whose parents have, in the poverty level or lower income level? And some of these children are on Medicaid access for healthcare issues. So how do you, so that was not everybody can work. What about you said somebody that's in long-term care and they've run out of all of their other funds, and Alltech is the last thing that they have. So there's some, there's a lot of things
or caretakers
and then, right.
Of
well,
those
and I,
people.
right. And, I did the same thing with my mother but I didn't have to stay home all the time. I hired people through a nursing organization to help me take care of her at home. But there are, there are situations that's not going to happen due to the location of the person living in, and it's so much better to have families take care of their own family. But we need to keep them in some financial source so they can buy the appropriate products that they need to care for their family member, whether it's special food or personal care, oxygen, all this other stuff that goes with it. And so I understand there's going to be a conference somewhere about through the Kaiser Foundation, Family Foundation, that a lot of the states are going to talk about. They're going to have a meeting about how do we define, what type of labor and how many hours. That we don't do that we don't do that with Medicare. I realize that because we're retired, and there are people that have a little bit of both too. I mean, it's
that's true.
Yeah, there's a lot of things in there and that is to walk into their shoes to really see what is going on. So I'm having doubts. They're saying they were going to give more equipment. 23% is going to make their more medical or diagnostic equipment tech, ER upgrades, data sharing. That's already there, but I realize we still have to, chemistry machines have to be updated every so often because new technology. But according to this, they're saying that 423,000. Yeah, 423,000 was in the ACA market plan in 2025, and it looks like 70,000. So 75,000 fewer Americans are covered in 2026 from that number. But yeah, you're right. They want to cut. They want to increase us. They're saying we'll cut in Arizona current 750,000 uninsured, which is 10%. I'm not. They're giving us money, but then they're going to turn around and cut them off of the program. I need somebody to really walk me through this.
No, it's crazy, and so I think the point is that this affects so many people, and I think I said it yesterday. The healthcare system, the health plans, they don't see who you vote for, right? Like you don't have a different color blood running through your body. When you need care at the end of the day, you need it, and you just don't want to die, or you want to be better, or whatever it is. And so policy, and this is like literally the impetus of like creating this series, Your Vote, Your Health, is because we realize that how much it's come up in so many conversations that we have with these like healthcare startup founders, these physicians that we meet. I'm like hearing you, like what you're saying from being particularly in rural healthcare, in Arizona or anywhere for that matter. Policy and legislation have lasting impacts on how we receive, access, deliver care, all of the things. And there's such a domino effect there. And all of these cuts are going to be devastating in so many different ways. So if somebody like you can make changes even at the state level, that can at least help, because Medicaid is state by state, just so everyone knows. Medicare is a national program. Health plans, Medicare Advantage plans can come in and get contracts in a state to manage your benefits as part of Medicare. But Medicaid is state specific. They all have different names. So ours is Arizona Health Cost Containment Center Access, HCCCS. I know a lot about Medicaid. I've worked in this space for a really long time. Actually, fun fact, the very first boss that I've ever had, and I will call him my mentor, Sam Thurmond. I worked for him at Schaller Anderson, which was Medicaid. You may even remember that name. It's now the Aetna Medicaid division, but he had come from Georgia, and he was known as the grandfather of Medicaid.
Oh.
And I learned a great deal about the very important role of Medicaid. And that's something that started back in the 80s. And Georgia was one of the first programs. Access actually has become very much a little bit of I would call a benchmark for the rest of the country. I don't know if it is still today, but it was at one point because of how well the program was run. So,
and I think
but anyway,
they did do
Medicaid, is huge. Yeah.
And then Access was moved away from the Department of Health. It has its own, so it does report to the governor. So that's separate out of the Department of Health, so the Department of Health doesn't get involved. And I think that may be a good thing. So the other is so then you have federal designated clinics that get a grant. The one that I am aware of is that they were through the United States Public Health Service, and they would help pay. If you worked for this clinic for 3+ years, you would get some of your medical cost, your loans paid. And you still got a living wage as a doc, but you did. I mean, the docs would come in every 3 to 4 years. You would rotate them out, and that was so then you get a variety of physicians. You get the latest that's coming out of medical school, so that really keeps the staff up to date. And they point out, increase, good patient plans. So when you look at that, some of the clinics, of course, they either, if somebody retires or something happens, then do they cut that, quote, we always have to have some pediatrician somewhere, but you can have family medicine doctor also treat them. And then you may have, but if you're somewhere in a really rural community, to entice, unless you can have somewhere where you can help pay off that loan, how are you going to get, you're not going to get a general surgeon, but you might get somebody in to do some testing, like colonoscopies or something, to come in once or twice a month. And you might get a part-time surgeon. And then on top of that is, are you going to still have OB? So if you don't have OB anymore because it's just too low, it's hard to keep, and you need always 2 docs because you've got to have relief. But if then you get to the point where you have, so a family practice or any doctor can really manage an OB, the prenatal issue. But if you have to drive 100 miles while you're in labor to the near, I'm just thinking, you live on the,
That's a
it
scary
gets to
thought,
be, yeah, it
especially
is
if
scary.
you're like a high, yeah, whatever high risk. Well, we have like maternity deserts now, right? Like that's the
Right,
one thing that's
right.
been coming up, and that's so
Yeah.
true in rural areas.
And then,
Yeah.
besides that,
Yeah,
and
there's
then
just not enough of the actual doctors.
I mean, and that's just, yeah, there's been many a baby born on the roadside, and hopefully that the officer, the law enforcement, and or a paramedic or a fire person can come and help. But in Alaska, you're
Yeah.
required to come and they had apartments or small in Juneau when you were at 8 months plus, because you can't be on a boat for 2 hours to get into the nearest hospital. But this is, because there's two clinics in Greeley, and there's several here I know in Graham County, and I think there's 8 to 10 in Cochise. I can't swear by that. Although Cochise County has got a full uh, 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 hospital in Sierra Vista. It's under it's under another organization. It's an excellent. It does do very well on some, because I had a friend that worked for one of their other hospitals, and they did very well. So, but still, you have to figure out, if I have something going on in Wilcox, I have to truck into Tucson. And there is a hospital now. I think it's TMC has got a hospital on Houghton Road. So you have to look at these little laws, and they're not looking at where people are living with this bill or with these changes.
Right.
So
I think they're not looking at a lot of things with those changes.
Yeah, I don't think they are looking at a lot of. They're not seeing the trickle down effect of what this bill does.
The ripple effect, like then all of a sudden, all the facilities that are left start getting overcrowded. They get all these people without insurance showing up at the emergency rooms.
Right.
Who's going to pay for that in the end?
And then where do those people go?
And then where those people go? And then everything's overcrowded and everything's stressed. The whole
Yeah.
system starts breaking down.
Yeah. And the people that say, well, I won't be affected by it because I live here and I have an insurance policy. All of a sudden, it becomes your problem too.
Yeah, it's going to be everybody's problem.
Because, and so you have to wait longer to get into, you have insurance, but there's just so many beds. And it's, they have to keep retriaging who gets the next bed. You can't play favorites. You can't pick a number and say, well, it has to be triaged clinically as to who gets the next bed based off of the patient's condition. And that the other is the dialysis units are starting to they're losing some funding. And you have to, you can't go more than a day and a half without having dialysis. It's either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. That is your life. And I've worked in a couple other areas in between here, New Mexico, and California, where to even plan a trip, I have to get to and back in a day and a half. And now the patients have to go longer, farther. I mean, anything 100 miles to me is dangerous for any medical condition. Being in labor, having to go and get dialysis, that sort of thing.
Yep.
We have had patients get a ride 100 miles.
Yeah. I've had patients where they had to come in every day to get their dialysis, their insulin, because either the pharmacy was closed this was a long time ago. I mean, we're talking when things were not open 24/7, or they were not getting the approval to have they didn't have the money to even buy it. And so those things, and I realized I don't think hopefully it's not as bad as today. I'll have to find out, but yeah, those are just areas. I mean, as I keep thinking about, I can bring up stories from the past, and they're not all mine. They're friends of mine too. I keep in touch with a lot of our retired RN and retired medical personnel, We're another group out there.
Well, grateful to you for coming out of retirement. We've talked a lot about healthcare, but I know that another one of your platforms is public education. I'm extremely invested into public education. My kids have gone through the public schools here in Flagstaff. Also, public ed kid, New Jersey, him too. And we talk a lot about the social determinants of health on this show. I think education is one of them. Education is, I think, very much tied to your health. And so I'd love to talk a little bit about that and kind of your perspective, your goals around public education here in Arizona, which is like significantly underfunded. And I think Jeremy and I can say, having grown up in Jersey and Massachusetts, we were like heavily funded public ed.
Oh yeah, I got a good education in public schools back in Boston.
I can say my public education is probably equivalent to private school.
Well, Arizona's ranked like 48th or something like that in
It's
the country
sad.
for education. Like we're near the bottom.
It's so sad.
We're very near the bottom.
Yeah, what a disadvantage our kids have. And the public ed system can be a lot better. And the voucher system is 100% taking. Now, by the way, my nephew, high special needs, access, all techs, long-term care, all the things. He goes to a special school down in Mesa and he uses those vouchers. 100% he needs that. He deserves to have that. But not just anybody who decides that they don't want their kid to go to public school does, in my opinion. They are weakening the public education school system as a whole. So anyway.
Well, yeah, they've been doing that systematically since the 1960s, though.
Yeah. So, well,
that's why we're where we're at.
Yeah. So what's your take on that? Like, let's talk about that a little bit, because I think it's really connected. And those are two really main platforms for you.
So my daughter went to public school. She did do some parochial first couple years of her life. And from the 4th grade on, she was in Sauterita Unified School District. And in my understanding, I thought this law kind of came into play sometime in the 90s. And I think it was on the ballot. And I don't ever recall hearing any problems, with the school district. I mean, I always voted for them to override so that they can keep the buildings and supplies, the equipment, and their buses are all up to snuff. And so she graduated in 2002, and I didn't hear a thing until about 10 years ago. Then all of a sudden I hear this stuff that's going on about you can go in and sign the paperwork and get $7,000, and you don't have to prove that you don't have to even show them who your child is. You don't even put down your child's name. And then I went to a couple of, I've listened to some people come to meetings and talk about it. And then finding out just recently in the last year and a half, they've been doing some research and follow the money. That great sign. I love that movie, but follow the money. Just keep following where and to find out that this money is just stashed in a savings account, or they took it. Somebody went to San Diego Zoo. Well, we have great zoos in Phoenix and Tucson. I mean, why did you? And, it was the guy says it was all educational. Excuse me, you can do that in Phoenix and Tucson, and do the San Diego Zoo for your own vacation. But that's what they were using the money for, non-educational items. But the seriousness of this is there's no attendance records being submitted to the Department of Education. There's no academic curriculum. I know when I sat down with my daughter and we mapped out her 4 years of high school, we discussed what track she was going to be on. And I realized I was a little pushy about it, but I said, I missed out on some things because my mother didn't know. She just didn't have that skill set to understand what children needed in the 60s versus when she went to high school. So, I mean, I understand that. So this way I had to really sit down and say, this is what we're going to do. And to find out that they don't even submit a curriculum to the state. They're not,
That's crazy.
no testing.
I didn't realize that.
No testing to say, where is, my daughter had to go to all the testing to say where she was at and also where her school was at on reading, math, whatever. There's a lot of things about that.
How is that fair? I just that isn't fair.
There's no oversight. It's like these kids just get.
That is not
to do
equal.
So
that's not like an equal. What do we call it? Equal playing ground or whatever.
Yeah.
And I agree. I don't have all the knowledge about this because I'm on the edge. And now that we've got this petition out, I figured I'm going to take. I'll take a back seat and let them work on this petition to at least bring accountability back to the voucher system. And the other one was besides academia.
What petition?
It's hang on, let me find it.
Petition?
Let me read it. Continue it. Let me see if I can get this right. I don't want to say the wrong thing. Initiative measure to submit directly to the vote electors is to strengthen the transparency, accountability, and safety and empowerment scholarship account, which is the ESA program, commonly called vouchers, while protecting access for students with disabilities and other pre-2022 eligibility categories. Limits eligibility under the 2022 expansion to families with annual income of $150,000 or less adjusted annually. So anyone who makes $1 million would not qualify for this. That is my interpretation.
Okay.
So the safety. So as a nurse, you have to have, depending on your role, you have to go through background check to make sure you have not had a sexual abuse, harassment issue, or any other child endangerment. So these teachers that are doing this other school system are not going through background checks to see that they have a hidden record. So your children are being exposed to people that may not be up to a better standard. So that to me is a key piece. But they're saying transparency, accountability, and safety is the three parts to bring. And transparency is to, again, we need to document that you do have these kids in the classroom and that they're there every day on the appropriate time. I mean, they did it in high school. They do it in public school. And
yeah, that's crazy to me that they don't have to have. It sounds like they have no responsibility to anyone.
No accountability.
Nobody's taking any record of what they're doing.
So I mean, somebody that's done something.
We're just feeding them money.
Yeah. So I mean, and it's limited. So the people that make more than $150,000 a year would not qualify for it because they obviously have the money to send their children to private schools at their will, and they are in private schools,
right.
Obviously.
Yeah.
But, we don't
They're
know.
all at Brophy and Xavier down in Phoenix. Yeah.
So I mean, and back in the 50s, private parochial schools, whether they were Catholic, Lutheran, Jewish, you had to pay because it was separation of church and state.
Yep.
Oh yeah, you can use vouchers for religious schools now, huh? I didn't even think about that.
Yeah.
So you can really just bring it wherever you want. They just give you the money and you can take it wherever you want.
And in my opinion, okay, and
isn't that money supposed to be for public schools specifically?
Right. And most of the people outside of the people that really need it, like my nephew, right? Like where they 100% depend on that to get him into this special school to give him the most viability of his life as possible. Most of the people that get the vouchers, they're homeschoolers, they're sending them to religious school, whatever they're doing, they have money already, right? And it's the kids and the families that are in the public education system that are being hurt the most, in my humble opinion.
Yeah.
So, because you're pulling that money away from the school district. And I served on a board for a public charter school several years ago, which is closing, sadly.
Oh, really?
Flagstaff Arts and Leadership Academy. Really?
Fala's closing?
Fala's closing. Yeah.
Oh my God.
Yeah. And take a guess. A lot of reasons why they're closing.
Yeah.
But I got to understand how many kids you have in your school, right? Is you get a certain amount from the state. I don't know what the dollar amount is anymore, because this was back in I want to say 2017, 18, 19, around there, 20. And that is how you fund your school. That's how you pay for picnic benches. That's how you pay for the AC unit to be, maintenance. That's how you pay for books. And so you have to have, every school has a minimum threshold of how many kids they need there in order to operate at optimal, levels. And so when you start losing kids because they're being through the voucher program, right? They're doing homeschools, they're doing these micro schools, which is fine. But if you're pulling that money out of that big bucket, then that amount that those schools get, they get less. Is that right? That number goes down because they have to spread it around, essentially. I'm not even sure if that's how it exactly works.
There is a disconnect between, so you have, because we pay our school through our property tax, and then that money goes to run the school, the buildings, the buses, lunches, all of that. I know we do override for budgets. They do bonds to help with improving the infrastructure. But to increase salaries is limiting, because this is pulling money away from. So my property tax is helping some child somewhere to be homeschooled. That's the way I would look at it.
Right. Yeah. That's what I meant by the money is for the public school system.
There is some state funding off of the state trust fund, and I don't have enough knowledge on that. I know that also is fed into the school system. Again, my last comment on this is to become the majority. Nothing can be fixed until we have both houses in the majority of the Democrats. I think it may upset a lot of other people because they don't think, they're pro-life or there are other issues that they're concerned about, but it's our future.
Yeah, I agree. And, like we said, education and healthcare go hand in hand, like many other things, housing, food in our stomachs, right? All of that's related. And so, your focus in healthcare, your focus in public education, so aligned with me personally. So I am happy that you're running. And I hope that people listening, we do have a lot of Arizona listeners here. If you are an LD19, please check out Jackie Anderson on the Arizona List website, arizonalist.org. You can find her profile out there. And do you have a website that we can share?
Yes, I do. I think it's
oh no, you're good.
I think it's Jackie at Jackie for Arizona, something like that.
Okay.
Here we are.
We'll make sure we get it into the show notes, but this has been, I think, such a great conversation. So just getting your opinion and your perspective on things with healthcare in Arizona, we've got some serious problems that are coming down the pipeline that are already here. So people like you, if elected, can help fix it for, all Arizonans, rural and in the city for that matter. So working with your fellow counterparts. We just need a Democratic House, right?
Yeah.
And Congress.
And I just, for the record, I am not a party guy. I wholeheartedly believe that 60% of the populace, it registers as independent. We should have
Right here.
60% of our candidates independent.
Mm-hmm.
That's my personal stance. I just want to put forward that I am not a Democrat, but I stand firmly behind the concept that we have to elect Democrats right now
Mm-hmm.
to at least get us back on a path where we can start fixing things.
Yeah.
Because the Republicans are broken.
Yeah.
Thank you. Thank you. That's
my
very well
personal
said.
stance.
Mm-hmm. Mm-hmm.
I
agree.
am not a Democrat. If things were working properly, I probably wouldn't be voting Democrat, but I will be voting Democrat.
My husband and I have been independent since we were able to vote, and we only changed to Democrat when truthfully, when Trump was running for the first time, because I wanted to make sure that I could vote in the primaries. My husband still gives me a hard time. He's like, "Are you ever going to switch it back to independent?" I'm like, "I don't know."
Not yet.
Not quite, because I need to be able to vote in the primaries.
Yeah, it's true though.
I used to vote. I never voted party line. I voted for McCain. I've namely remember him. I've voted for a number of Republicans over the last 25 years. Not in recent years, unfortunately. So, but we got to get the people in these seats that are going to make the right decisions and look out for us in the best way possible. And right now, that's almost entirely Democrats, if not all, in my opinion. So I think that's what Jeremy and I agree on.
Yeah, I would like to see it start there and then move toward the whole independent thing and kind of, not have the parties take all the power.
Yeah.
Because if each party only had a third of each branch, then people would actually have to work together. And nobody would be able to just hold sway like that. Like that's what we really need. The two-party system is inherently bad that way. Yeah, like the European styles where they have, 4 or 5 different parties in their legislative body, so that none of the parties have a big majority ever. Once in a while, maybe one of them will get an actual majority, but it'll be slim. Most of the time, they're all just a plurality. They all have to work together to make anything happen. And if they refuse to work together, then they don't get to do anything.
Yeah.
That's really how it should be.
Agreed.
Definitely.
Agreed.
You get one party in charge of everything like we have the Republicans now, and look what's happening.
Right. Wow. Well, Jackie, you ready for this?
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!